So I declare that the scene is safe. There is nothing that will cause trips or fall. I'll provide privacy for my patient by closing the doors or drawing the curtains. And because my hands are visibly clean, I will take small amount of alcohol gel and clean my hands following WHO guideline. Palm to palm, palm over dorsal, vice versa. Fingers interlace, fingers interlock, vice versa. Rotation of the thumb, vice versa. Tips to palm, vice versa, wrist and wrist, and then I'll wait for 30 seconds for my hands to dry. Assuming my hands are dried, I'm now ready to approach my patient. Hello, good morning.
Hi, good morning.
My name is Chichi. I'll be your attendant nurse today.
Hello, Chichi, good morning.
Hello, I'm here to conduct a thorough wound assessment so that we can know the progress of your wound and then determine the next line of management with regards to your wound.
Yeah, no problem.
Is this a good time?
Yes, it is.
And so since all checks are done, I'm happy to proceed.
Okay.
So I'm going to ensure that a thorough pain assessment has been conducted prior to performing a wound assessment.
Okay, no problem.
Okay, and now I'm going to be examining the wound for any signs of redness, erythema. So there is obvious erythema around the wound. All right, and then I'm also assessing the area around the wound for blisters. There is no blister, but there is signs of inflammatory process. There is swelling, it's swollen, and it shows signs of inflammatory process. And again, I'm also checking for exudates. It seems like there is a dried up exudate along the lines of the suture, right? And if the wound continues to produce more exudate, I'll be taking a wound swab and then I will send it down to laboratory for further investigation, right? So, and also, I'm also checking for the closure of the wound. So the edges of the wound are in close approximation by 10 sutures. There is no missing suture, right? And I'm also checking for the condition of the floor. The condition of the floor is not visible because the edges of the wound are in close approximation. So, but I'm seeing that there is signs of inflammatory process, and I'll be escalating this to the tissue viability, right? And for pain and tenderness, do you feel pain around the wound?
It's just a little bit in between.
Yeah. All right, so from a scale of 0 to 10, 0 being no pain and 10 being the highest pain,
it's not much, maybe around 3.
3, okay, that's all right. So if you require any pain medication prior to this wound dressing, do let me know, okay?
Okay.
All right, so any tenderness?
No.
All right, okay. So like I said, I'm going to encourage you to continue to, promote good personal hygiene to prevent cross-contamination of the wound. And like I said, I'm going to be escalating this to tissue viability. And if the wound becomes exudating, I'll be taking a wound swab and I will send it down to laboratory for further investigation to know the next line of management.
Okay.
All right. So continue to drink plenty fluid, and after the wound dressing, I will encourage you to keep the wound nice and dry, okay? All right, thank you very much for your time. I'm going to leave you now for a while to go and prepare the equipment ready for wound dressing. Use your call buzzer if you need anything, okay? Thank you. Or just do my hand.